No matter who told him to, he shouldn't have signed it. Okay, one more question. That's it. Thank you all very much. Thank you, fellas. Thank you.
All right, that was stunning. The President of the United States, just to acknowledge that he is taking hydroxychloroquine, a drug that meant really to treat malaria and lupus. The President has insisted that it has enormous benefits for patients either trying to prevent or already have COVID-19. The fact of the matter is, though, when the President said, "What have you got to lose?" in a number of studies, those certainly vulnerable to the population have one thing to lose: their lives. A VA study showed that among a population of veterans in a hospital receiving this treatment, those with vulnerable conditions, respiratory conditions, heart ailments, they died. There are also a number of other studies out, including the Journal of the American Medical Association, which examined some 1,438 individuals in the New York area across 25 hospitals from the middle of March to the end of March. The study was a real chance to look at the benefits that the President insisted were hydroxychloroquine. They concluded that among residents hospitalized in metropolitan New York with COVID-19, the treatment or both compared with neither treatment, no statistical differences. A second study done by Jacek Jeleris and colleagues at the New York Presbyterian Hospital, Columbia University Irving Medical Center in northern Manhattan from March 7th to April 8th also showed there were no visible differences, that the risk of intubation or death was not significantly higher or lower among patients who received hydroxychloroquine versus those who did not. The VA study to which the President alluded wasn't a loaded political one. It was a test on patients there, and those who took it in a vulnerable population, including those with respiratory or other conditions, they died. I want to stress again, they died. If you are in a risky population here and you are taking this as a preventative treatment to ward off the virus, or in a worst case scenario, you are dealing with the virus, and you are in this vulnerable population, it will kill you. I cannot stress enough. This will kill you. So again, whatever benefits the President says this has, and certainly it has had for those suffering from malaria, dealing with lupus, this is a leap that should not be taken casually by those watching at home or assuming, well, the President of the United States says it's okay. Even the FDA was very cautious about this unless in a clinical trial safely and deliberately watched. I only make this not to make a political point here, but a life and death point. Be very, very careful. I want to pursue this with Dr. Bob Lahita at St. University Hospital, chairman of medicine. Doctor, yep. What would be your take on the President saying he is taking this as a preventive measure?
I was actually very surprised waiting to talk to you about the vaccine, and then I heard his meeting, and we have had no evidence whatsoever, and we use it in those who are very sick and those who come in who are, and this was used like 2.5 months ago, and we saw absolutely no effect. People patients of mine with lupus, rheumatoid arthritis have been on this drug forever. It's very useful in those conditions. But as far as our treatment of COVID-19 patients, whether you're slightly ill or very ill, we have seen no effect whatsoever with this drug.
Is there any danger, doctor, and this is where you could help out far more than me, advising people who might say, well, it might be a good preventive measure. The President of the United States is taking it. He thinks it's going to be beneficial. He's had no problems in the last week or so. So why shouldn't I? You say what?
Well, the problem with the drug is very simple. This is a quinine-related drug. So this drug, in addition to Zithromax, which is the zithromycin the President mentioned, can cause a widening of a certain kind of polarization within the heart. We see it on the electrocardiogram. When that widening is too great, it's called the QT interval. When that widens, you can have a fatal arrhythmia, which means an irregular heart rhythm, which will cause your death. And your death will be instantaneous. You wouldn't know what hit you, and the people around you would say, oh my gosh, he's lost consciousness, he's unresponsive. And unless a paramedic or a doctor or a nurse is right there that can reverse this arrhythmia, you're dead. And that's a big issue. So I don't advise anybody to go out and take Zithromax or to take Plaquenil, as it's known, or hydroxychloroquine.
I don't know the medical makeup of the attention the President of the United States gets, doctor, I assume among the best in the world, and that the White House doctor would write off on this.